What affects the consistency of breast cancer staging? Imagine trying to piece together a puzzle, but some pieces are clearer than others, and the picture keeps changing slightly. That's similar to how breast cancer staging can vary. Several factors influence how consistently we assign a stage to breast cancer. First, the staging system itself evolves over time. The main system used is the American Joint Committee on Cancer's TNM system, which looks at tumor size, lymph node involvement, and whether the cancer has spread to other parts of the body. Every few years, this system gets updated to include new scientific insights, like tumor biology and genetic information. These updates can change how stages are defined, making consistency a challenge over time. Next, the biological features of the tumor play a big role. Beyond just size and spread, doctors now consider tumor grade, hormone receptor status, and HER2 status. These factors help predict how aggressive the cancer might be and influence staging. But measuring these markers can vary between labs and pathologists, which can lead to differences in staging outcomes. Imaging techniques also affect staging. Tests like mammograms, ultrasounds, MRIs, and PET scans help determine tumor size and whether the cancer has spread. Differences in how these tests are performed, the technology used, and how doctors interpret the results can cause variability. Some guidelines recommend more extensive imaging for advanced or aggressive cancers, while others suggest limited imaging for early-stage cases. This variation impacts how consistent the staging process is across different settings. Pathological assessment, which involves examining tissue samples after biopsy or surgery, adds another layer. Variations in how pathologists evaluate margins, lymph nodes, and biomarkers can influence the assigned stage. Additionally, differences in regional guidelines and available resources mean that some places might perform more thorough staging than others, further affecting consistency. Finally, cancer is a dynamic disease. It can change or recur after initial diagnosis. While staging is usually done at the start, if the cancer spreads later, it's often classified as stage 4. This can create confusion because initial staging and later disease status might not always align perfectly. In summary, the consistency of breast cancer staging depends on evolving guidelines that include biological factors, differences in imaging and pathology, regional practices, and the natural progression of the disease. Healthcare professionals carefully consider all these elements to ensure accurate staging, which is vital for choosing the best treatment. Always remember to consult your healthcare team for personalized advice and the most current information.